Hi, I'm JPMojica. Thank you guys so much for allowing me to speak today. I'm the Executive Director at the Center for Progress and Excellence. We are a local non-for-profit serving the 5 counties, Charlotte, Lee, Collier, Hendry, and Glades. We have 3 government contracts. The first one is a federal contract. It's through Trafficking Victims Assistance Program. It is to serve foreign-born clients identified at the border who have been trafficked. Unfortunately, it's not domestic. They have to be identified at the border, and it's a federal contract. We provide case management to those clients. It's a 12-month program. We provide financial assistance for housing, for legal status, citizenship status, residency status, education, clothing, whatever that client needs, because this will be the first time they are entering the U.S. They've been, like I said, they've been identified as being trafficked elsewhere from the U.S. It's a 12-month program, and we provide, like I said, financial assistance. Our second program is the Department of Juvenile Justice, serving kids between the ages of 12 to 19. The referral sources come from the juvenile probation officers. Dependent on the crime committed by the client, if it's a violent crime or if the child is stating that they need some mental health resources, the DJJ makes a referral over to CPE, and we provide a 16-week outpatient counseling. We see the clients at homes, at schools, sometimes in the jail if they violated probation, once a week for 16 weeks, just to kind of lower recidivism and allow them to process kind of how they got into the system. Now, our major contract is the Mobile Crisis Response Team. It is completely funded through the Central Florida Behavioral Health Network. It is a 24/7, 365 crisis hotline. As we all know, this crisis cannot be scheduled. So I have a master's level clinician who answers the phone at any time. That is our dispatch. Basically, if a call comes in, we have 3 different levels of a phone call. We have the routine phone call, which is someone who's not having any active suicidal ideation or doesn't even have any suicidal ideation. They're just looking for resources. Someone who might have lost their job due to the pandemic. Someone who might be having problems with their girlfriend or their parents, just looking for some resources. Then we have our urgent calls. Our urgent calls are someone with passive thoughts, who might have had some self-harming behaviors in the past. And then we have our emergent calls, someone who is actively suicidal, someone who has, has had previous attempts. They might not have a plan, but they have indicated to somebody that they're having active suicidal thoughts or ideations. So what happens is when we get a phone call, we dispatch out to the location. We send a master's level clinician who does the suicide assessment. It's called a SAFE-T. It is ACA based. That is scores based upon how the client answers. It scores it from severe all the way down to minimum. When the master's level is speaking to the client, once we arrive on scene, the master's level is tasked to utilize motivational interviewing skills, crisis intervention, de-escalation techniques, as well as a suicide assessment. Now, while the master's level is doing this with the client, the bachelor's level is talking to the people in the home, in the schools, in the hospital, kind of getting a background of how did the client get to this crisis. Because sometimes when the client is in crisis, they can get kind of tunnel vision. They don't know exactly how they got there, but they know that they are feeling an abundance of this emotion. So the bachelor's level is kind of doing a psychosocial with the community or the family members, seeing if has there been any previous bake racks, involuntary placements into the CSU. Have they ever had any treatment, any family history of mental illness? That kind of thing that will kind of give us a clearer picture of how the client got to this crisis moment. And then once the master's level is done completing their suicide assessment, we have licensed mental health professionals that are on the clock 24/7 as well. The licensed mental health professional is completely through telehealth. We utilize a HIPAA compliant software that's called Doxy, where the master's level will call the licensed professional on Doxy, giving them the scoring of the safety as well as kind of what's going on in the situation. It is then up to that licensed professional that if they want to speak with that client by them and do their own assessment or take the master's level clinicians by the word. Now, if it's a high or severe risk of suicide, they are to do a telehealth assessment with that client individually. If the client is still having active suicidal or homicidal thoughts, that licensed professional will will initiate the Baker Act, the involuntary placement. That licensed professional will send that Baker Act form to the master's level on shift, who then will contact law enforcement. Unfortunately, due to liability and insurance purposes, we are not able to transport. We lean on law enforcement to do all of our transportations to the CSUs. But all the paperwork will be done. The licensed professional will send it over to the master's level, and then law enforcement will transport to whatever available CSU is in that location. Essentially speaking, the thought process behind mobile crisis is the local law enforcement and NAMI do a great job doing crisis intervention. They absolutely do. The uncomfortable truth is that just sometimes when law enforcement shows up, that uniform can just make a client have more of an anxiety or anger or an emotion. Local law enforcement do a great job. They absolutely do. Just that uniform can cause the fight or flight kind of emotion that comes with that. So we send mental health professionals out to do the mental health assessments. No matter if a client gets placed on the Baker Act or if they do not, we provide wraparound services in regards to a peer specialist, a mentor, who will do face-to-face with that client once a week for 30 to 45 days. As well as that peer specialist, we provide a case manager who will be involved for 120 days. That case manager is tasked to give a needs assessment to that client or that family to determine what kind of daily living that they might be deficient in, and then they will make that service linkage to the community. We lean on Centerstone a lot, Salis Care, Elite DNA, Charlotte Behavioral, David Lawrence. We lean a lot, Hope Clubhouse. We do a lot of referrals to the local organizations just to ensure that this client is safe. I'm a firm believer of it does take a village. That's so cliche, I'm sorry about that. But so all of our services are completely free. It is completely funded through the Central Florida Behavioral Health Network. And the client also does not have to call themselves. We've gotten multiple phone calls from, because everything has transitioned to telehealth, a clinician who, it could have got hairy during the session saying, hey, this client is having suicidal thoughts. We will dispatch out. Our only caveat is suicide is not a game. When we knock on that door, we're going to say, Dr. Simeone, let us know that you're having some suicidal thoughts. Can we sit down? Can we talk and see, kind of assess what's going on? We're always going to indicate who made that referral because we want to establish that trust with that client on an initial visit, as soon as we knock on that door. There is no age limit to our services. We go all the way from infant all the way to the geriatric population. So if you have any questions, the abuse hotline is 844, I should know this, 844-395-4432. Also, we are in the office. Our office number is 239-689-8490. And our website is www.progressandexcellence.com. Thank you guys, and have a good day.